I'm going to speak to you guys about stroke. The stroke is, this is a definition of stroke. I'll go ahead and just talk through it. Maybe you could just translate right when I finish the slide. This is a disease that affects the arteries leading to the brain. A lot of times it gets misinterpreted and people think this is a heart condition. This is a brain condition. Okay? It's also called a cerebrovascular accident, and there's different types of strokes. There's a hemorrhagic stroke, which is bleeding. There's an ischemic stroke, which is kind of a clot forming. And then there's what they call a mini stroke. These are all things that basically affect a clot to your brain, and they can kill brain cells.
Okay, trato de explicar rápidamente. Un derrame afecta las arterias cerca del cerebro y dentro del cerebro. Hace un daño permanente. Los resultados podrían ser bien graves. Y después, en los últimos dos puntos hablan del tipo de derrame y, bueno, varios tipos de derrame. El primero es... hay tres tipos y tienen la gravedad varía.
Okay. This is the first type of stroke. Este es el primero tipo de stroke, es cuando está sangrando, okay, in the brain. Okay, this is 13% of stroke. La primera causa de este tipo de stroke es presión alta. Okay. Anything to add on here from in Spanish? 13% of strokes are this bleeding type. Okay.
Hemorragia, ese tipo de
Okay.
derrame.
This one here is called the ischemic stroke. This is the most popular type of stroke. Este es most común, popular. Es cuando la sangre cerebral es alta. Okay, it's the blood flow has stopped to the brain. Hay muchos riesgos como diabetes, fuma y más. Y colesterol es más importante que pueden causar un ischemic stroke. Okay. So this is just a little bit of information about it. I'm going to tell you how to identify a stroke here in just a minute. Este tipo de stroke es mini stroke. Can you just tell them this one lasts 1 to 5 minutes?
Hay tipos de derrame chiquitos que solo duran entre 1 y 5 minutos. Si él está hablando de ese tipo de derrame ahorita, es una señal que podría seguir algo peor.
Exactly. The most important thing about this mini stroke is that this is the biggest warning sign that a bigger stroke might come. So these are something that shouldn't be ignored. If a mini stroke happens, then you should really be consulting with a doctor.
Es muy importante hablar con un médico si alguien tiene lo que él va a explicar en los próximos minutos.
Okay, just a couple facts. This is the 4th leading cause of death overall, or anything. Heart conditions being the first, and accidental death. But this is the 4th, okay, and it is the biggest cause of disability. So more people end up in wheelchairs and disabled because of strokes than anything else.
Es la causa principal de incapacidad y es la 4ª causa principal de la muerte.
Okay. This one is specific to the Hispanic population. Hispanics have strokes. Research has shown that the Hispanic population has strokes at an earlier age. So you can see the 67 for Hispanic population is the average age that a stroke occurs, and this is from the American Stroke Association. And the non-Hispanic gender or ethnicities, we tend to have strokes a little bit later.
Las hispanas tienden a tener derrames antes que los que no son hispanos. Y la edad promedio de sufrir un derrame es 67 para hispanos. O hispanos. Eso es para all Hispanic persons.
All Hispanic.
Okay, para todos los hispanos es 67 la edad promedio y 80 para gente que no sea hispana.
Okay. Diabetes is the most important factor. A lot of the 30%, research has shown that 30% of the Hispanic population has diabetes, and many of them are undiagnosed.
El 30% de hispanos tienen diabetes y ese es el factor más grave que dirige a derrames.
Okay. Other things include the lack of insurance. Research has shown that the Hispanic population tends to have a larger population of uninsured persons. So that can affect the health care and put you more at risk if a person does not have health insurance.
Okay, al no tener seguro médico, eso es otro factor, porque la gente sin seguro médico tienden a ir menos a su doctor si tienen algún problema. Entonces, eso es otro factor atrás de derrames.
Okay. These are a few risk factors. Hypertension, presión alta, primero, okay? That's the biggest. Cholesterol, diabetes, problemas con corazón, heart problems, and alcohol and smoking, even birth control.
Son los factores principales. Presión alta, colesterol, diabetes, problemas con el corazón, alcohol, fumar. Aún control de nacimiento tiene que ver, y la edad también es importante.
Okay. Okay, so now we're going to talk about how to recognize a stroke.
Muy importante eso, es cómo reconocer si uno tiene un derrame en proceso. Y creo que eso tiene que ver con los chiquitos también, ¿no?
I'm sorry.
This has to do with the small strokes.
Yes, the same. The
TIAs.
mini stroke is the same. Okay, mini stroke. The acronym we're going to use is called FAST. Okay, and each letter stands for one of the 4 steps in recognizing a stroke.
La palabra fast es muy importante para reconocer derrames. F, face, cara. A, arms, brazos. S, speech, de hablar. Y T, time. Son factores muy importantes.
Okay, so the first is the face. We're looking for things like facial droop. Okay, and this is all. These are symptoms that happen suddenly, de repente. Okay, so you can ask the person. You can ask them to smile. Okay, you can ask them to close their eyes and lift their eyebrows. And if there's any kind of loss of feeling or movement, then those are things that we're looking for in the face.
O sea, es muy importante fijarse en la cara. Si un lado de cara tiende a caerse un poquito, o la persona no puede sonreír bien, o hay cambios en la visión, o las pestañas tienden a uno es más alto que el otro, todo eso es síntoma de un problema que podría estar en proceso.
The arms, the test, if you have the person put their arms out like this and close your eyes, okay? And a stroke, a lot of times you'll have a drift.
Si alguien pone sus brazos recto y cierra los ojos, un brazo tiende a caer más que el otro síntoma.
Okay? And el mismo por las piernas también, okay? For the legs if they go numb as well. But the test is for the arms, okay? The speech, okay? Slurred speech.
Sí, es difícil hablar y pronunciar bien las palabras. Otro síntoma.
Okay, and this you might be able to notice in normal conversation with the person, but you can also have them repeat a phrase, okay, and that can test their cognition as well as their speech.
Se puede pedir a alguien repetir alguna frase relativamente sencilla y ver, es otra prueba. Si no puede hacerlo bien, otra vez es síntoma que algo peor podría estar en proceso.
Okay? And the next thing for the T is time. This is just saying that more than 2 million brain cells die per minute. Okay? These brain cells do not regenerate. So sometimes there's other wounds. If we have a wound on our skin, that wound can heal. Our cells can rebuild. But with the brain, once those cells die, they do not grow back.
Dentro del cerebro, si alguien tiene derrame, podrían estar muriendo 2 millones de células por minuto. Y muy importante mencionar es que el daño es permanente, no pueden reponerse.
Okay.
Otras células en otra parte del cuerpo, por ejemplo en la piel, sí pueden recuperar algún problema, pero el cerebro es diferente.
And there's medications that can be given if we respond quick, if we get to the hospital quick enough. But if there's a time lapse and it takes too long, then they can't give that medication oftentimes.
O sea, el tiempo es clave. Hay que llegar al hospital rápido a pedir atención médica lo antes posible. Porque hay medicamentos que pueden detener el proceso.
Okay, and that's it. That's the 4 acronyms. FAST, F-A-S-T. Okay, so face, caros, brazos, hablando, y tiempo. 4. Okay?
Cara, brazos, hablar y tiempo.
Okay. And if we want to ask if they have any questions, or if anybody is